talk about hamstrings and hamstring problems or hamstring injuries. It's actually a very common problem that can really happen to anyone. I think a lot of times we tend to think that hamstring injuries only occur to athletes, and that's really not the case. It's something that is very common with everyday activities that we do. So if you do any bending during the day, if there's any exercise that you do, whether it's walking, running, taking the dog for a walk, anything like that, or even if you're doing any kind of repetitive activities, cleaning the floor, getting things out of the washer or dryer, emptying the dishwasher, tying your shoes, anything that's repetitive or involves any bending or any activity or any exercise really puts you at a risk for hamstring problems. And that's why they are so common, and not just only in athletes. The common causes of hamstring problems really amount to three things. First is that your hamstrings are a very long muscle, and that muscle needs to be able to stretch to allow you to do things like bend and walk and etc. The second cause of hamstring problems is that your hamstring is actually a very big shock absorber for any activity that you do. So think about when you're walking, there are ground reaction forces that are coming up through your leg, and it's the job of the hamstring, at the same time it's doing many other things, to actually contract and absorb that impact so that it doesn't end up being absorbed by your knee joint or your back or your pelvis or your hips. The third cause of hamstring problems is really weakness in hamstring muscles. It's a very weak muscle in most people because it is so long of a muscle, and that weakness really ties into the fact that when you're walking, the weakness doesn't allow you to pull through and to take a good step. So if we use walking as an example, so three things are happening simultaneously. First, that person has taken a step, they've put their leg out in front of them, so the hamstring muscle needs to lengthen out down the back of the leg. Secondly, at the very moment that that heel hits the ground, that hamstring muscle has to absorb all of the impact from the ground reaction forces. And then right away, that hamstring muscle has to switch over to producing a contraction that would propel you forward and allow you to take that step. So remember, your hamstring muscle is a muscle down the back of your leg. It runs from your buttocks all the way down and crosses over behind your knee. And that muscle is doing all three of those things at the same time. And when it can't do all three of those things at the same time, you end up having problems. And most commonly those problems they start out as pain and stiffness and soreness in that muscle itself, somewhere in the back of the leg, somewhere in your buttocks, somewhere down into behind your calf. When that progresses a little bit further, you'll start to have some difficulty like getting in and out of a chair, getting in and out of the car. Progresses a little bit further, you'll start having some problems with walking or going up and down stairs. It'll just be difficult for you to shift your weight from side to side. If it progresses even further, you're going to start to have some problems with low back pain or some problems with knee pain. And if it goes unhandled long enough, and by long enough I mean sometimes a couple of weeks, it can start to lead to bigger problems like lumbar disc problems, deteriorating disc or degenerating discs. It can start to be a contributor to arthritis in your knee joint or in your hip joint. There's a very simple way to really help to get that under control, and getting somebody who's trained and knows what's happening with the body, and that's what all of the physical therapists here at Loudon Sports Therapy are able to do. Having them take a look at, number one, when are you having problems? What are the things causing that hamstring to be tight? And really, if you're having problems with things like pain or stiffness in your legs, or problems going up and down stairs, or knee pain or low back pain, getting somebody at Loudon Sports Therapy Center to take a look at that and do a full evaluation and assess and let you know what are the things that you should be doing to get that problem under control. So if you call today or if you click the link that's right below, we can get you started and get somebody to do a full evaluation, help you to figure out what's going on and get you feeling better and prevent some bigger problems from happening.